Hi, I'm Andrea Harmon with the Elder Law Firm, and I'm here with Nicole Reynolds with Wellspring Home Health. Hi,
Good
Nicole.
morning.
Thank you for coming
Thank you
today.
for having me.
So, can you tell me a little bit about Wellspring Home Care?
Sure. Wellspring Home Care provides assistance for people living in their home.
Mm-hmm.
We have certified nursing assistants, so they can come into your private home and
Mm-hmm.
provide assistance with things like housekeeping, bathing, dressing, errands,
Mm-hmm.
anything that someone might need
Okay,
to help them stay independent and stay at home.
great. Now, is this only for the Wellspring community, or can anyone in Guilford County use this service?
Wellspring Home Care is for anybody that lives in Guilford County. That is our service area currently.
Mm-hmm.
So we are not limited to just providing services to folks at the retirement community. We serve for anybody living at their home
Okay,
in the community.
great. Now, if somebody wanted to set these services up, is there someone that they would contact? Would it be you?
They can contact me, but we have a main number
Mm-hmm.
where someone can help them answer any questions they have and hopefully set up an appointment for myself or one of the other administrative staff to come out and meet with them and go over what we have to offer.
Mm-hmm. So you kind of do a little assessment with them.
Yes, depending on what the needs are. So if they require any hands-on care,
Mm-hmm.
then a nurse would have to come out and do an assessment. But if we are just providing basic home housekeeping and things like that,
Mm-hmm.
then it does not require a nursing assessment, and
Okay.
I can come out and meet with them and go over the contract and discuss services and what we can do to help them.
Okay. Now, I know you were saying this is like a non-medical, but you had said, mentioned that you can do some medication help with them, which is unique.
We can. We have what we call a medication management program.
Mm-hmm.
And how that works is we have nurses on staff that will come out and gather together all of the medications that this person is taking and kind of do what we call reconciliation, make sure that there's not prescriptions of the same medication prescribed by different physicians.
Right.
And they will straighten things up, contact the doctors to make sure that what they have is what they are currently supposed to be taking.
Mm-hmm.
And then we, from there, pretty much manage everything. We do refills, and then we fill a weekly pill box and we bring it to their house once a week.
Mm-hmm.
So the only thing they have to worry about is actually taking the pills.
That's great.
We manage everything else.
And that's so huge because you hear a lot of times folks getting their medicines mixed up, causing them to get sick or in the hospital.
So typically seniors have several different medications that they're taking from day to day. It's not uncommon for them to have multiple prescriptions, and it can be confusing. So them maybe forgetting that they've taken a medication and taking it again later in the day, or two different doctors have prescribed the same drug and they don't realize that it's the same.
Right.
All of those things can cause a hospitalization, can cause issues with their independence and taking care of themselves. So we have seen some tremendous changes in seniors that were having difficulty keeping up with those things, and when the nurse kind of comes in, we've been able to eliminate some medications by them assessing and speaking to the doctors and kind of taking that over. It can be overwhelming, even for children of seniors that are managing it. So
Most definitely.
it's a huge relief for the senior themselves and their parent and their children to not have to worry about that. And it prevents hospitalizations, it can prevent falls. It's a big deal.
Yes. So it sounds like you're big on trying to keep the senior in the home as safe as they can be and as productive as they can be.
That is correct. I think if you asked anybody what their first choice would be, it would be to stay at home.
Correct.
And so by the services that we offer, we can help make that happen.
Nicole, tell me what is the best way when I know that everyone asks, how do you pay for this service?
Home care is paid primarily private pay. Insurance, unfortunately, Medicare does not cover care in the home.
Right.
If someone has invested in long-term care insurance, typically those policies have a payment option for home care services. So if you are thinking about home care, we always encourage you to look at your policy or speak to your financial advisor or the person that helped you establish that, and they can tell you whether or not there's coverage. And our staff does assist with the filing process.
Okay.
So if you have a policy, you can give it to our staff and they will look and make the right connections and help fill out the paperwork to file claims.
That sounds great. Now, you said there was a number that would be good to call. Is there a number, website that they can reach out to?
There is. They can reach us by phone at 336-545-5446.
Okay.
And they can also visit our website. It is well-springhomecare.org.
Great. Because I know a lot of people do a lot of web searches
They
now.
sure do. They sure do.
So
Yes.
they can get some information from there.
They sure can, and we always encourage them to call us. That's what we're here to help.
Great. Well, thank you, Nicole. This has been very informative.
Thanks for having me.
I've learned something today, so thank you.
You're welcome. Thank you.
This is Andrea Harmon with the Elder Law Firm. Thank you for tuning into this segment.